But let's go to one of the big announcements, in fact the biggest announcement really from the government today, which is our plan for patients receiving easier access to NHS and social care. And we turn to Health Secretary and Deputy Prime Minister Thérèse Coffey, who joins me now. How are you going to mandate that doctors see patients within a certain time frame? How will you actually bring that about? Health Secretary, good morning.
Good morning, Nick. Well, patients are clearly my top priority, and when we've been talking in a different way about developing plans for prevention, very clearly patients often express their frustration about they can't get to see their GP. That's why we've been looking in detail, and we can see a wide variation across the country, but I'm conscious that I will be setting, and am setting those expectations, that we want GPs to see patients driven by clinical needs. So, of course, some people will need to be seen the same day, and many GPs do this brilliantly already. But what I am aware of is that we need to work with the local NHS to help practices to perhaps share best practice on how we can improve that performance and meet the expectations of patients so they can get to see their GP when they need to.
When you say see, Secretary of State, do you mean see, or does that include a telephone or video consultation?
Well, I think that's open to the relationship between the GP and the patient. I know that throughout the pandemic, there's been a variety of ways that people have interacted with seeing their GP.
So it could include a telephone call?
I'm not going to be overly prescriptive. I know that some people enjoy just having a phone call but may need to go in and see the doctor. I know that other patients are very keen in that regard. But the important thing is, Nick, that it's only in the last week that we've been getting data out of NHS Digital, and we can see that wide variation. And more than half of practices are already meeting expectations. I want to make sure that we're targeting some help and support to share best practice so that we can satisfy more generally the needs of patients when it comes to accessing primary care. Because we should remember that is the primary route for people to get into the NHS. And we expect people to still come forward and try and get the diagnosis and treatment that they need.
And there will be league tables to be published, is that correct, Secretary of State?
I'm not intending to take a lead table approach. I think it's important that by publishing more information, patients can be better informed, but it also helps us and the local NHS to be able to target support and opening up. But one of the things more broadly we're doing, for example, is giving pharmacies the opportunity to provide prescriptions, which up until now have only been available by going to the GP and getting a prescription. And we'll continue to work on this and see what other elements we can do to free up that time so that GPs can be in contact and have that opportunity to see their patients directly.
But what happens to a doctor who just fails to meet your request? Let's say there's Dr. Ferrari in the leafy environs of coastal Suffolk, and he's just not seeing his patients within 2 weeks. What's going to happen to that doctor?
Well, we'll continue to develop on a local level, I think, interaction.
Clearly nothing.
And
Clearly
intervention.
Nothing. There's no sanction, is there?
Dare I say it, Nick, one of the points about also opening up and publishing data by practice is it may give some patients the opportunity to choose to use a different GP and to make that swift as well.
But there is no sanction, is there?
That change as well. But in terms of, I think that this is a positive way in terms of we're not prescribing how we do this, but things like opening up more phone lines to help people get through. There's a variety of things. And
It's
I'll be
a headline grabber,
some more
isn't it?
detail.
Secretary of State. There's no meat on the bone.
Nick, this is about a clear expectation.
Let's go back to Dr. Ferrari, who's not seeing his patients within 2 weeks. In fact, he's not performing that. There's no sanction that you have.
Well, in terms of what if patients of course patients are seeking care, that they may be able to switch to a different doctor, and then of course that will reduce the funding that goes into that doctor. But the important thing is that I want to work in a proactive way in order to make sure, as I say, that we share best practice, have local NHS focus on where patients aren't getting the service that I would expect.
Secretary of State, this is words. This is all words, isn't it?
That's not true,
There's no
Nick.
need. Well, OK, can I refer you to the
That's not true at all.
But
as I say, it's about freeing up GP appointments. It's about changing some of the funding rules. At the moment, doctors can't use certain aspects of the funding in order to get support staff or different medically qualified people into their practice. We're removing some of those. I think the other elements is about some of the pension flexibilities, which doctors have said to us has been a problem for them. But that's why we're making some of those changes in order so that people can stay in the NHS longer, but indeed also those who've retired, making it more straightforward for them to return and come and help the NHS in this time and share in that national endeavour during this national emergency.
How fair is the criticism from the Royal College of GPs that says this will only serve to add to the intense workload and workforce pressures of GPs and our teams while having minimal impact on the care our patients receive? That appears fair criticism. Secretary of State.
Well, what I would say is that many of the GPs are already clearly have a great relationship with patients. As I say, we'll be starting to publish data which will inform patients but also allow us to target some interventions and some of our focus for, as I say, things like we'll be having elements of providing more phone lines to those practices, freeing up some of the funding rules so that they can bring in staff, but also recognising, as I say, some of the diversions away from GPs so people don't need to go to their GP in the first place.
Right, OK. Let's turn to other matters. Obviously, you have the distinction of serving as Deputy Prime Minister as well. The Prime Minister met with Emmanuel Macron in New York, I understand, and a number of your fellow Conservative MPs are surprised that she failed to raise the Channel migrant crisis. Why was that, and would you have raised it?
Well, Liz Truss has been Prime Minister for just over 2 weeks now. Clearly, we've had the very sad event of the death of Her late Majesty, and we had a gathering of world leaders come to the funeral.
I don't see how that impacts
respects.
this question, respectfully.
Well, I was about to say she's covering a wide number of international leaders in terms of meeting President Biden at UNGA, but also, of course, President Macron. I think this is just one of the first more formal face-to-face meetings that has happened. She will continue to develop that relationship, but importantly, the Home Secretary, our new Home Secretary, will continue to work on this particular challenge about the migration boats. I think it's right that the Prime Minister set out to the UN her main focus about being the champion for Ukraine and how we must be resolute.
Sorry, would you have raised the migrant crisis with Monsieur Macron?
Nick, I think
it's a yes or no, isn't it?
Nick, I think it's for the Prime Minister to decide what the issues she's raised and when she raises them with international leaders.
Do you share some of your colleagues' disappointment that it wasn't raised?
I do not share any disappointment whatsoever, Nick. In that regard, I do trust the Prime Minister, and I think she has already hit the ground running in this time of national challenges, and I'm looking forward to her continuing to show her leadership. OK,
and lastly, a lot of her leadership, I imagine, will be stamped on the mini-budget or fiscal event, whatever we must call tomorrow's work, from your colleague, the Chancellor, and we understand he will announce 120,000 benefit claimants will have to take active step to find work or they will lose their benefits. This from a government, of course, that's looking to lift the cap on bankers' bonuses. This isn't about levelling up, is it? This is just helping the rich.
In terms of the Prime Minister on the doorstep of Downing Street set out 3 key priorities. One of them was about tackling the energy crisis that we were facing in terms of the impact on household bills. We've done that, and we've also extended that to businesses and the public sector too, as well as the long-term energy supply. She talked about the NHS with a particular focus on patient getting access to appointments. That's why we're setting out our plan for patients. And she also talked about growth, and it's important in a variety of ways about how we approach our growth, and that is including getting more people to be working in the many unfilled vacancies, as well as people doing a very limited amount of work today. That's why we continue to extend the number of people who are currently on benefits, about how we can help them find perhaps more higher paid work, or indeed about taking up more hours. This is a combined approach in order to recognise that we want to improve the lives and prosperity of people in this country. I'm grateful for your time this morning. Thank you. Secretary of State for Health and Deputy Prime Minister Thérèse Coffey appearing here on LBC 2 minutes after 8. Let's get the latest news headlines.